Appendicitis is an inflammation of the appendix. Appendix is a finger-like extension which is part of the large intestine. It is also called as vermiform appendix as it looks like a worm. The history of mankind reveals that this appendix was used by us for digestion in the earlier years. Hence, when it gets inflamed or ruptured, surgeons prefer it to be removed. Removal of an appendix is not known to cause any side effects in our body as its function is very minimal. This process of removal of the appendix is called as appendectomy. In the journal The Annals of Surgery, they have mentioned that in the 21st century, the incidence of appendicitis or appendectomy is high in newly industrialized countries like Asia, the Middle East, and Southern America. In India, the incidence of appendicitis is gradually increasing for sure. Appendicitis may be caused due to various infections like bacteria, viruses, or parasites. It could also be irritated from a fecal impaction, lumps, or tumors. Even a foreign body, if stuck in the appendix, could cause trouble. These infections or lumps may cause a pressure on the blood capillaries, causing a hindrance in the normal blood supply, giving rise to pain and tenderness of the abdomen, especially on the right lower part or around the umbilical region. This in turn could aggravate the complaints and cause the appendix to rupture. If not identified or treated on time, the stool collected in the appendix could spread to the abdominal cavity and cause irritation and infection of the entire abdomen, causing a severe emergency-like condition called as peritonitis or sepsis. Probably, this is the very reason that surgeons prefer the problematic appendix to be removed than treated with medicines. Appendicitis usually presents in most of the population with an acute onset of pain. It is noted that in some, it comes on suddenly and over the next 24 hours, it could lead to a rupture if not identified on time. The common signs and symptoms include acute pain starting as a mild discomfort and worsening in nature. The pain increases on movement and the abdomen on the right lower quadrant or umbilical region feels tender to touch. If the appendix has ruptured, then you will find the whole abdomen sore. You may also experience fever, nausea, disturbed bowel movements like constipation or diarrhea associated with it. This confirms an infective origin. Sometimes, difficulty in passing gas could be an early sign as well. Hence, any recurring or persistent abdominal pain should not be overlooked or treated with over-the-counter drugs without an expert opinion. Appendicitis is clinically diagnosed on a physical examination done by an expert and confirmed on ultrasound, CT scan, or an MRI. Your physician will manage you on antibiotics first to control your infection and monitor you. If you are recovering, a surgery may not be recommended. However, if it's a ruptured appendix, your doctor will advise you for an emergency laparoscopic removal. If you notice recurrent inflammation, you can also consult various alternative medicine experts who have known to significantly reduce the chances of going for a surgery. Surgery should only be a last option if it is life-threatening. The best way to prevent appendicitis is to include fiber-rich food and ensure the bowel movements are normal. Avoid food that are fatty, greasy, or hard on digestion. Lower the daily sugar intake. Avoid white rice and shift to red or brown rice. Avoid aerated drinks and alcohol. Include more fruits in your daily routine. Keep yourself hydrated. This will wash the toxins from your intestines and soften the stool so that it can prevent constipation. Start your mornings with lime and water to enhance detoxification of the bowels. Include food agents that can cool your bowels or improve digestion like buttermilk, aloe vera juice, fenugreek or meaty seeds. Pomegranate or beetroot juice is a great food to your gut. Appendix may become a nuisance if not taken care of, but remember, it is created by God for a purpose. It does build immunity by improving your gut health and preserving the good bacteria that aids in the normal digestive mechanism. Removal is not a solution. Approach an expert who can help you overcome the illness and lead a healthy life. To know more, write to us on unearthwellbeing@gmail.com. Do like, share and subscribe. Spread the knowledge on appendicitis to your loved ones.